What are the most important things that mothers who are recently pregnant should do? Today I have my friend and my sister with me, and we're going to be sharing 10 very most important things mothers should do as soon as they find out that they're pregnant. Welcome back to my YouTube channel, guys. My name is Unyime, and with me is my friend and sister, Dr. Unyime. Alright, I should call you that, right? Unyime is why are you hitting my head? I'm not editing this part out, just so you know. You hit my head, that's how it's going to be. Yes. Okay, guys, welcome back to my YouTube channel. With me is my friend and my very good sister. We've known ourselves for years now, and she's a medical doctor and a mom. And she's currently expecting, guys. So she's the right person to talk to us about what are the most important things that mothers should do as soon as they find out that they're pregnant. So I remember that 3 weeks ago, a couple of weeks ago, I guess, I called her up and I was like, "Oye, how you doing? How's everything?" And then we had, of course, she's part of our support community, and we had someone who was, in a position where, we felt like it was because of the lack of information that she couldn't make the decisions that she needed to make. And Unyime just started mentioning the things that mothers need to, do immediately when they find out that they're pregnant. And I said, wait, you have to be on my YouTube channel to say these things, because there were things that I myself, even as a maternal mental health intervener and a mother and child health expert for the last 7 years, I was like, oh, actually, I didn't know that mothers should do that. You should come on my YouTube channel and share this with my audience. Guys, no other person is fit for this conversation today. Unyime is very passionate. If you have ever been under her care, as a medical doctor, she will give you top notch. I'm not even joking right now. So we are honored to have you here today, Unyime.
Thanks so much.
Thank you so much for joining. When you had that conversation with me, you said some very profound things. So I wanted to share with my audience what's like the very first thing a mother should do as soon as she finds out that she's pregnant.
Okay, once you've confirmed you're pregnant, so most times people use a urinary strip, go to the hospital, do a blood test, and confirm. Once you do that, start taking your supplements. Basically, folic acid in the first trimester is the most important. So even if you can't afford the combination supplements, you could just go straight, take folic acid for the first 3 months. Then subsequently you could add other ones.
So I remember that you mentioned something about going for an early scan.
Yes.
So share with us.
That's the second point.
Oh,
the next
okay.
thing is that you should go for an early scan. An early scan is an ultrasound scan that is done to find out about the viability of the pregnancy. That is, are you really pregnant? Because sometimes a blood test may actually say you are pregnant, but by the time they check your womb, it may just be that there is no living fetus. So the early scan is done in the first trimester. That's the first 3 months of pregnancy.
How early?
Once you from 6 weeks.
Oh, really?
From 6 weeks, it's easy to able to identify the uterine cavity, then also identify the sac, the embryo sac, and the fetus itself. Wow. Then also you can pick up the heartbeat at that stage. Wow. So usually from 6 weeks, you should be able to do an obstetric scan.
You know why I am curious, and I'm quite like, oh, so people can actually go for a scan in the 6th week, because I am used to mothers wanting to go for a scan in let's say when they're already 16 weeks, they're already some of them 18 weeks before they start thinking about going for a scan. And for you to have said that, oh, going for an early scan is very paramount to determining the health of the pregnancy. So what is the next thing a mother should do when she has started taking a supplement and have gone for an early scan?
Okay,
you can go ahead and mention your tips.
No problem. The next thing is to decide where you want to access antenatal care, because there are different places you could access antenatal care, and with COVID-19 even coming up, at a point antenatal care services became online. But the basic thing I would say is ensure that wherever you're accessing antenatal care, at least you have a place where they can intervene when there is an emergency.
Exactly.
Most people, they don't anticipate emergencies in pregnancy, but it's always good to be prepared. So even if you may not be going to a tertiary center, for example, that's a place where they could assess emergencies on a regular basis, you should just have a plan that in case there's an emergency, at least I have this hospital where I can go to assess care, so that you're not taking unawares.
Wow. Wow. The funniest thing is that you know that for Unyime, she's a born again Christian. She's a doctor. I like the way she mixes, you know, her Christianity with, you know, medical science, and says, hey Edidio, let's always be preventive first. Let's always be here first. Always one step ahead of anything that might want to come up. What other things should a mother do? You've mentioned, I think we've done our third point.
Yes,
so let's do our fourth point.
So the next point is healthcare financing. It takes 9 months.
I like this one. Wow, I like this one.
It takes 9 months to actually birth a child, but we find out that in our setting, most people are not prepared when it's time for delivery because they don't anticipate that some things may go wrong or there may be one challenge or the other. You could go to a hospital maybe to access care, and for one reason or the other they may tell you, oh, you may not be able to do a vaginal delivery, we want to do a cesarean section for you. And they become apprehensive, not because of the procedure per se, but because they are not prepared financially. They only put in mind that we're going to have a vaginal delivery. But if you plan your finances, and it can be two ways, either you have a health insurance or you pay out of pocket. So if you are paying out of pocket, it means you have to have a saving plan. Make inquiries, how much will a cesarean section cost where I'm assessing care, and begin to plan financially for it. Also, neonatal service. Most mothers experience jaundice in their kids. Even maybe after they've been discharged, for one reason or the other, they may have to come back. And because they didn't plan, they are not prepared. So find out about neonatal services. What's the cost for neonatal service? And plan. If you're under an insurance plan, make an inquiry. Is it covered under my insurance plan? If it's not covered, what's the cost? And plan financially for it.
Okay, so this thing that you're saying for me is really profound, because we live in a society where we just want to get away with actually planning for things. And every time I come on here, guys, I always say it is not okay that you are on your preconception journey. You guys already know I'm on my preconception journey, that you are not making financial plans. You are not preparing financially. You are preparing in every other way, trying to conceive. How much have you set aside to keep for your pregnancy and your postpartum journey? Like she said, I like that you mentioned that neonatal care. Do you know that a lot of us don't even think about it? So what next thing should a mother do?
Okay, the next thing you should plan for is support care during pregnancy. Many mothers or expectant mothers, they go through the pregnancy journey alone. Even if you may have a spouse, your husband is working, and all, in some cases your spouse may not be available, but you should just plan to have a form of supportive care. We all know that during pregnancy hormones are high and we get so emotional, we get so overburdened sometimes. Then if you are not a first-time mother, you may have a toddler, or you may have other responsibilities, or if you are a working mom. So you need to have supportive care, a community group, whether in church, whether online, just a group of people basically that can be there for you other than your spouse. Your spouse is not enough. There are times your spouse may not even understand what you're going through, but if you have women that have been through what you're experiencing, or women that are experiencing what you're experiencing, it's easier to go through the journey and it eases off the burden. So plan for supportive care during pregnancy and even after pregnancy. Many mothers get overwhelmed after delivery because of some new time, first time moms, they don't have an idea. And even if we have maybe our mother-in-laws or our mothers, they may not understand certain things, even if they've experienced what we've experienced. But we're in a new age, things are evolving. So just ensure that you have people around your age group per se that are currently experiencing what you're experiencing, or have experienced what you're experiencing but are not too advanced, that you can easily relate with and express how you feel.
Wow. So there's a point you made that I really liked. You said it doesn't matter if you're a first time or a second time mom. So I always say this, guys, no two pregnancies are the same.
True.
And you're not even prepared for the pregnancy that is to come. No matter how even if you like, let it be that you've had 10 pregnancies, the 11th one will be a different experience entirely. But the most important factor that we mentioned is support. So guys, pay for support. I always say this. if you have to pay for support, go ahead and pay for support, because the truth is that support that you're not paying for is going to hurt you in some ways. So if you are able to reach out to pay for support, paying for support can mean getting a domestic staff to help you. It can mean asking for help and actually asking, oh, I need this and so care from your healthcare worker, from even people around you. How can I access social support care during my pregnancy period? So those are the things that is very, very important. I like that when you mentioned that. When you mention your next point, and let's just go ahead.
Okay, no problem. The next thing we need to look out for is plan for breastfeeding and lactation. I like this point. I know I expressed it during my first pregnancy. It wasn't any issue, but I had problem with latching because I didn't really prepare my breasts in preparation for breastfeeding. They said it during antenatal, but we didn't take it seriously. Yes, I'm a doctor, I know the theory and all, but I didn't take it seriously. So it was a big challenge having to learn how to help my child latch. First, the breasts, I wasn't cleaning it. I wasn't cleaning my nipples. So one way to prepare, you clean your nipples regularly. When you're having your bath, you clean it, because there are some times that the ducts may be blocked. So even when you deliver and it's time to breastfeed, because the ducts are blocked, the breast milk can't come out. So it's good for you to clean regularly. Also, you have to learn to massage your nipples, because you don't want your nipples to be flat or to go in, because that was the case I had in my first pregnancy. My nipples were flat, so latching for my child was a big issue. So the preparation I would have done while I was pregnant, I was now doing it after, and it was more challenging and it was really frustrating. So other ways is, in preparation for lactation, stay hydrated, drink a lot of water. Many people believe when you take maybe kunu or you take this, you take that, yes, it may help, but the easiest and cheapest way to prepare for lactation is by staying hydrated. Drink at least 3 liters of water every day.
During the pregnancy period?
Yes, and even during breastfeeding after you deliver. But it starts, because something that is not a habit, it's hard for years. So start during pregnancy, so that it's something that you've already gotten used to. Then you could now add lactation products to help to boost your milk production. So basically that.
Two questions on this point. When you're cleaning your nipple, do you use a special instrument?
No, you can use cotton wool. Just soak it in water and just clean and ensure that the nipples are clean. If there is anything obstructing it, you clear it up, because there are sometimes, just like when you get pregnant too, though, for those that their navel are inside normally, by the time you become pregnant, it shoots out. So you clean also those debts and all. So some debts too may accumulate in your nipple. So just use cotton wool so that it's not harsh, and water, warm water or just normal water, and just clean and ensure that the pores are open. That's the essence of cleaning.
The second question, you mentioned the breast milk boosters that people use. When is the appropriate time? Because I believe that when you have put to bed, that's like the time you start taking the boosters. Can you take the boosters whilst you are still pregnant?
Yes, you can take it like late third trimester. You can start from late third trimester, just like you take your normal tea or your biscuits and all. You just take little, maybe once a day, depending on the products you get and how it's being prescribed. But the essence is to boost the milk production. So you can start shortly before you deliver, from like anytime 32 weeks upward. That's fine.
Wow, I'm really enjoying this session, guys. So if you have not subscribed, this is a good time to subscribe. And if you have watched up to this point, before we go ahead with our next point, I think it's the last 4 points. We've done 6. I want you to give this video a thumbs up. This is a good time to give it a thumbs up. Remember to share it, and also share with everybody that you know. Let them see this, and let us all join hands together to get mothers to be informed during their pregnancy period. So the next point now.
The next point is place and mode of delivery. Like now in our setting, I know one thing I've noticed is sometimes where you do your antenatal may not necessarily be the place you deliver. You see some people, they do antenatal in like 2-3 places, they say just in case. But in as much as you do that, have a plan, know where your priorities are, like have it in order of priority. This is where I want to deliver. Then also discuss mode of delivery. During the course of the pregnancy. If you decide you want an elective CS, you should decide it ahead of time so that it helps you to plan financially. Then above all, just be prepared concerning the mode of delivery. But it's good to have an idea before delivery so that you're not taking unawares. So basically that's
and there's nothing wrong with wanting an elective CS, really.
Yeah,
there's nothing wrong with it. Just accept it that it is okay. Let's normalize elective CS. Let's normalize cesarean sessions. Let's normalize it. There's nothing like normal delivery and abnormal. Every delivery is normal, whether it is vaginal, cesarean, epidural, whatever it is, it's normal. So the next point
is pain management during labor.
Good. I like this.
Most people don't consider that because they will tell you, oh, you deliver like the Hebrew women, that means there will be no pain. Maybe, I don't know. But definitely for those that have gone through vaginal delivery, even cesarean section, there is definitely going to be pain. So you have to decide, do you want to bear the pain? If you don't want to bear the pain, there are options for pain management. Yes, they could just use normal medications, normal injections, and they give you. But there are other options that actually manage pain where the labor process is painless. That's where you use epidural. But that one costs money. So when you have an idea of whether you want pain management or not, it helps you to plan, helps you to get prepared. So most hospitals make epidural anesthesia available for labor. So if that's what you want, also know that you need to get prepared for that.
Wow.
Yes.
This particular point that you've made is really vital, and it popped up like a question in my head. I know that for you, if, like I said, guys, if you have ever met Unyime and she has ever given you care, you know that it's different. It's actually going to be different from every other doctor that you've ever experienced. But I am concerned, this information, the reason why we're sitting here today is because many healthcare workers don't bring themselves to a position to explain in details, what the mothers need to know. What the mothers need to know when they are pregnant. And some mothers don't even know what is going on with them. They just say, oh, doctor said this, doctor said that. They're not even sure of what they want. So they can't even make the decision, right? So what do you think healthcare workers can do differently before you answer the other point?
Okay.
What do you think healthcare workers can do differently to get to understand, a client that is under their care or a patient?
Okay, so basically it begins with the training of the healthcare worker, because if you're a healthcare worker, empathy has to be priority, because the patient comes to you. When they come, they are vulnerable. They come because they are in need of assistance, they are in need of help in ways that they cannot help themselves. So you have to be empathic towards them. You have to listen. Even if you feel you have all the answers to their question, let them express themselves. Let them get to understand where they are coming from, so that you can know what they need to unlearn, and you can be able to teach them what they need to learn. A patient that comes to you with the same condition may not necessarily need the same answer, depending, because when you want to manage a patient, you manage the patient holistically. You're not just thinking medications, this is the routine, this is what we do. No, you have to be able to treat the patient as an individual and give that individual what the patient needs. Even if there is a protocol and there is a standard, you have to personalize every care.
Wow. Yeah, I like this thing that you're saying. I like these points that you are making are really vital points. A lot of healthcare, these issues are real.
Yeah.
I've had people send me messages that how come healthcare workers don't even listen to even understand. So the most important point when you make here is listen to understand. As a healthcare worker, listen to. You might know it all, truthfully, but if you don't even understand where the patient is coming from, you might not be able to help them. Okay, so let's make our last 3 points. Have we done?
I think we're ready to.
Oh yeah, okay. So let's make our last 2 points.
Second to the last one is living arrangements. You have to plan. Yeah, once you know maybe how many kids you're expecting, if it's a single, so that's 1 child or 2 or whatever, you have to plan. Do you want to move into a newer apartment? Do you want to rearrange your home to suit the arrival of your newborn? So plan towards living arrangements so that you're not taking unawares. When it comes to bringing in a newborn, so many things need to be adjusted, because the immunity of the baby cannot be compared to the immunity of those already living in the house. Ensure that wherever you are is properly ventilated. If you need to do some rearrangements, or if you need to relocate, or whatever, just ensure that the living arrangement suits the child.
Yes.
Because if you don't anticipate that, you could create more problems for your newborn.
Exactly.
If you are living in a place that is overcrowded, maybe the house itself, even if you are living in a one-bedroom apartment and maybe you are a family of 3 at the moment expecting one more child, you can still live in a one-bedroom apartment in such a way that it is not detrimental to the child if you plan the living arrangement very well. Wow. So that's another thing to put into consideration.
I like that you said this. It's baby proofing. That's what we call it. You baby proof and prepare. These things are not even underrated. You shouldn't even underrate them. It's very important. So let me give you a story. I brought in my nieces. They are toddlers. The oldest is 3, and I have this urge in my room that I have wounded myself on before.
Okay.
I was so apprehensive when I realized it. I was like, how come I didn't do this? How come I had to ask my brother to go and look for something to find a way to cover that place? And I kept on watching them all through just to make sure that they don't, get injured with that particular position in my room. So baby proving and preparing for the child when they come is very, very vital, because you will just put yourself inside another wahala if you don't prepare. And last point, I don't want to go.
I love this
one. God, yeah,
I love this point, and I encourage all mothers to take advantage of it. And the last point is contraception and family planning.
Wow, I didn't see that coming. I didn't see that coming, trust me.
When dealing with mothers especially, they have this mindset that let's just have all our children at once before we do family planning. Then you now have some cases where while they are still breastfeeding, they take in and they discover they are pregnant. So the advantage of considering the type of, because when we say contraception, it doesn't mean it has to be implants, IUCD, all those ones. There are different methods. There, even if it's the calendar method, the natural method, is about what works for you, understanding your cycle, understanding all those, even condoms. Just ensure that you adopt a mode of contraception following childbirth. It's very, very important.
Immediately after childbirth?
Yes.
Doesn't matter if you're planning to have a child again.
No, even if you're planning to have a child again, when you plan, you know when you want to have a child.
I love
the spacing.
Yes.
You're not going to leave things to chance, because imagine you being pregnant while nursing a child that is under 1 year. The emotional stress, the mental stress it brings to you as the mother, it's not easy. You are dealing with the challenge of pregnancy, dealing with the challenge of meeting your infant's need. So it's not an easy thing to put yourself through. You can give yourself some space. And imagine if you had a cesarean section, for instance, and your body has to heal. Even if the scar heals, the womb has to heal. The scar on the womb itself has to heal. If not, you're at risk of uterine rupture. By the time you get pregnant again, you're at risk of having your uterus being torn out, and that's a life-threatening issue. The issue of maternal mortality now is what we really, really want to address. So it's good to put into consideration contraception. Just make your inquiries and look for what works best for you. First, okay, if I want to have a child, how many years apart? From there, you now decide what type of contraception you want to use. You now decide how early you want to start using it. Because if you want to start sexual intercourse as soon as possible after delivery, then you have to have a form of contraception you will be using that works for you to avoid getting pregnant as soon or sooner than you expected. So
I told you people that Unyime is going to come and scatter this place. I've never known someone so passionate. I have you were born for this. Trust me, Unyime. Thank you so much for pouring out your heart. Your doctor will not tell you this, but our doctor has told us. So Unyime, why are all these points important? Before I ask you the last question, why are all these important? I know you've mentioned them in some ways, but just reinforce it.
They say he that fails to plan plans to fail. So the truth is, when it comes to pregnancy, motherhood and all, even if we have the support of people around us, you need to put yourself first. Make yourself the priority, your mental health especially. So when you put these things into consideration, the chances of being taken unawares are slim.
Exactly.
The pressure already of being pregnant and going through the process of labor and going through the process of nursing following pregnancy, it's enough for the mother. So this is to look for ways to mitigate other areas that could add pressure. These points are the main things we've seen that brings issues.
Yes.
For mothers.
That's what
things,
this
yes,
conversation.
things that you see them, they complain about these things. Oh, they're under financial pressure because they didn't prepare, or I wasn't planning on having a child this soon. I'm thinking of terminating this pregnancy, or my child is always falling sick, my child is always running temperature, all those kind of things. So these are things that if you do, would at least mitigate these other areas that could add more pressure to
and be
you.
like a trigger.
Yes, and it will help you have a more stable mental health. So that's the essence of all we have discussed today.
You may remind me to hug you very well after this recording. Like, oh guys, I told you people that this is going to be massive. Unyime, thank you so much for pouring your heart.
Thank you.
The last question.
Yes.
Now, if I'm a 6-month-old and I'm just a 6-month pregnant mother, and I'm just seeing this right now, what should I do right now? Assuming I didn't know this, and I'm like maybe 8 months gone, and I'm just saying, no, I didn't do this. What should I do?
Okay, so basically identify the areas that you can still work on. If you're not on your supplements, start taking it. Better late than never.
Yes.
If or maybe financially you've not made all the inquiries you need to make, start making it. Start preparing. There is nothing that we've discussed now that you can't start
now
at any point that you identify. So basically start making do with the time you have left to be able to sort out as many of these issues that you can sort out.
Wow.
Yeah.
Guys, I know that you love this. I know. So just give this video a thumbs up, guys. I know. I'm not even doubting that you love this video. And thank you so much for watching up until this point. Please remember to join me on my next session. And I know I'm going to bring Unyime again. You know what? We have conversations that we're going to try to talk. Yes, definitely. We're going to have to make sure that access to information for mothers is there, easily accessible. So one thing I'm happy that YouTube does is that MCN has some partnership with YouTube that you can download videos at night for free. So they give you like a 4 gig access that you can download videos. So even if you're not watching now, or even if you cannot watch because of your data, you can always download it at night and watch later on. Thank you guys for joining me again. Until I come your way next time, it's a goodbye from me and Dr. Unyime. Bye.